Hello, everyone. Welcome to Lakewood Health System's Be Well Videocast. My name is Matt Jensen. I'm the Director of Marketing at Lakewood Health System, and today we're going to be talking about an innovative new speech therapy being offered at Lakewood, which is working to improve communication and speech in patients with Parkinson's disease. Fascinating new therapy. We want to find out a little bit more about that today. Here to chat about that with me today is a speech therapist at Lakewood, Kelly Taffe. Kelly, thank you so much for joining me today. It's great to have you with me.
Thanks, Matt. It's great to be with you today.
So, Kelly, Parkinson's disease, for those who may not be familiar with it, is a chronic disorder of the brain that impairs a person's ability to move and even communicate. You know, this disorder can interfere with a patient's independence and over time even affect their speech. As you know, these are super key issues in terms of quality of life for all of us to be able to have a lot of these things, to be able to continue to function with those things. The specific therapy we're going to talk about today is called LSVT therapy. This is a therapy that is clinically proven to improve communication in people with Parkinson's disease and also other neurological conditions such as stroke or multiple sclerosis. So kick us off a little bit today. Tell us a little bit more about what this therapy exactly is and why it might be beneficial to patients with this disorder.
Absolutely. So LSVT is an acronym that stands for the Lee Silverman Voice Treatment Therapy. It was created in the 1980s for Mrs. Lee Silverman and has been scientifically proven ever since to help benefit movement and communication function. There are two programs involved in LSVT. There's LSVT LOUD, which I am certified in, and LSVT BIG, which we have two therapists here at Lakewood that are able to perform that program. LSVT LOUD is used for the communication aspect. It is targeting your speech production, improving articulation, increasing loudness, improving intonation and facial expressions, as well as the neural function related to the specific areas of speech and voice. LSVT BIG is working on physical mobility to improve independence, safety, and ability to move throughout one's environment.
Great background on that, Kelly. So that really your expertise and the therapy that you're focusing on today is targeted to the voice and some of that inflection, and so important to people and their ability to live that healthy, normal life at home. Talk to us a little bit about what are some of the actual activities involved in this, and what are some of the tactics that you as a therapist use to kind of help these patients? And then also, if you could tell us a little bit about how long would a patient be involved in this kind of therapy? Are we talking about a couple of weeks? Or are we talking about a couple of months?
Right. So LSVT LOUD is comprised of several exercises used each session. The primary one is the loud ah, which is used to help build and strengthen and kind of manipulate the voice to help it become stronger and louder while still maintaining that healthy voice quality. We use that nice strong voice, then carry over it into other exercises so that going home you are able to use that good voice in everyday life. Both programs, including LSVT LOUD and BIG, use the in-person sessions, daily home exercises, and then a daily home program that is expected to be completed throughout the program and after the program in order to maintain the function built. The programs, each one lasts for 16 sessions in 1 month, 4 consecutive days in a week for 4 weeks. So it's pretty intensive. Each session is 1 hour in length. What you can do is complete both programs at the same time, which would be 2 hours of therapy, 4 days a week for 4 weeks. Or what you can do is separate the programs out, complete one at a time. And then another option is to complete the one that best fits you at this point. And if things change later on in the road and you want to complete the other program, that is always acceptable. You don't have to complete both at once. So the main program is 1 month long, and then there is usually some type of follow-up around the 6-month mark if needed, but generally warranted. But LSVT is proven to have sustaining success, which is really great for these types of programs.
Okay, so really, Kelly, we can offer both the voice and the BIG versions of this particular therapy. Excellent information for us to share today. So Kelly, if there's someone out there listening right now who might find this treatment beneficial for themselves, maybe for a friend or even a loved one, how would they go about getting in touch with you or learning a little bit more about this particular therapy?
The main way would to meet with your primary care provider and to get that referral put in place and to meet and discuss if LSVT is the right fit for you or your loved one. Another option is to call down to our rehab department at 218-894-8427, and we would be happy to discuss it further with you if you have any specific questions for us.
All right, fantastic information today, Kelly. Thank you so much for joining me. I appreciate having you with me. Have a great rest of your day.
Thanks, Matt. It was great to be with you today.